Congenital heart defects, often called CHDs, are problems with the heart's structure. These important problems are actually present right from birth. They can significantly affect how blood flows through the heart and also how it flows out to the rest of the body. CHDs are the most common type of birth defect found. They affect many newborn babies every single year. Understanding these defects is extremely important for everyone, including families, caregivers, and medical professionals. Sometimes CHDs are caused by specific genetic changes. These can be small changes in a baby's individual genes, or they might be larger changes in their chromosomes. These types of genetic conditions can sometimes run in families. For example, Down syndrome is a condition often linked with certain particular types of congenital heart defects. Genetic counseling can be very helpful for expectant parents. It helps them to understand these potential risks much better. A mother's health during her pregnancy also truly matters. Certain illnesses like rubella or uncontrolled diabetes during pregnancy can unfortunately increase the risk of CHDs in the developing baby. The choices of smoking or drinking alcohol during pregnancy can also cause serious harm to the baby's delicate developing heart. Taking certain specific medications might be a contributing factor too. It is absolutely vital to talk openly with a doctor about any health concerns or medications during the pregnancy period. Other different factors can also play a part in CHDs. Exposure to some environmental toxins could be one, or contact with certain chemicals might also be involved sometimes. However, it is important to know that for many babies who are born with congenital heart defects, the exact, precise cause is often not clearly known. Important research continues to explore all these connections. Scientists are working very hard to find more answers. This will help to prevent these serious conditions in the future. Finding congenital heart defects early is truly very crucial. An early diagnosis means that important treatment can start much sooner. This can greatly improve a baby's overall health status and significantly enhance their chances for a much better future. Doctors use several different methods for the detection of CHDs. Screening programs for newborns are becoming more widespread. These programs help to catch potential problems very quickly, sometimes even before any clear symptoms might actually appear. This proactive approach is making a big difference for many families. Many CHDs can thankfully be found even before a baby is born. This often happens during routine pregnancy checkups with the doctor. An ultrasound scan is a very key and common diagnostic tool. This non-invasive test uses sound waves to create images of the baby. It can clearly show the baby's developing heart structure and provide information on how it is growing and functioning. If a potential problem is suspected from this initial scan, more detailed tests will usually follow, like a fetal echocardiogram. This specialized ultrasound gives a much closer look at the heart. Sometimes a CHD is not found until after the baby is born. A doctor might hear an unusual sound from the heart. This sound is often called a heart murmur during a routine checkup. Pulse oximetry is another simple and painless screening test. It carefully measures the oxygen levels present in the baby's blood. Consistently low oxygen levels can be a significant sign of a heart problem. These initial health checks are incredibly important for all babies. They are a standard part of newborn care in most hospitals, helping to ensure any issues are identified as soon as possible. If a congenital heart defect is suspected, further tests are done. An echocardiogram is a very common and very informative test. It is much like an ultrasound but specifically for the heart. An electrocardiogram, often called an EKG or ECG, checks the heart's rhythm. Sometimes a chest X-ray is also needed by the medical team. This X-ray helps to see the size and shape of the heart and lungs. In some more complex cases, cardiac catheterization might be used. This procedure helps doctors get very detailed information about the heart. It can also sometimes be used for certain types of treatment. The main overarching goal of CHD treatment is quite simple. It is to repair the existing defect in the heart structure and to improve blood flow and overall heart function significantly. Effective treatment helps children to live much healthier lives. It also aims to reduce any uncomfortable symptoms they experience and to prevent potential future complications from developing. Each individual child's treatment plan is carefully designed to be unique. It is always tailored to their specific type of heart condition and their overall health situation and needs. Medications can help manage CHDs in several important ways. Some types of medicines help the heart to pump stronger. Other medications can work to effectively lower blood pressure, or they can help the body get rid of any extra fluid. Sometimes various medicines are used before a planned surgery. This is done to stabilize the baby's condition and prepare them. These medications can also be needed for the long term to manage the heart condition effectively throughout a person's life. Regular monitoring by doctors ensures the medications are working well. For some types of CHDs, less invasive treatment options now exist. These advanced procedures are commonly called catheter procedures. During this, a doctor carefully guides a very thin, flexible tube, a catheter, through the body's blood vessels directly to the heart. Tiny, specialized tools can then be passed through this catheter. These tools can repair holes or widen previously narrow vessels. These innovative procedures usually mean much shorter recovery times for patients. This is a significant advantage when compared to traditional open-heart surgery. They represent a major step forward in treating heart defects. More complex congenital heart defects often require surgical intervention. This might involve performing what is known as open-heart surgery. During this, highly skilled surgeons can repair or rebuild parts of the heart. They can effectively fix holes or even reroute blood flow patterns. Sometimes multiple surgeries are unfortunately needed for a child. This can happen as the child grows older and their heart develops. Heart transplants are a much rarer but life-saving option. They are reserved for the most severe and complex cases of CHDs, when other treatments are not sufficient to help. The outlook for children born with CHDs is much brighter today. This is largely thanks to truly amazing medical progress and research. Many decades ago, the survival rates for these conditions were limited. Today, the vast majority of babies with CHDs grow into adulthood. Even those individuals born with very complex heart problems are now living longer and much fuller lives than ever before. Early and accurate diagnosis combined with timely treatment are key. These factors are crucial to these significantly improved outcomes we now see. It is a testament to medical science and dedicated healthcare teams. Many people who were born with CHDs live active and fulfilling lives. They can often go to school, pursue careers, and have families. However, ongoing specialized medical care is frequently needed throughout life. Regular checkups with dedicated heart specialists, cardiologists are vital. Some individuals may experience certain physical limitations or challenges, or they might need to take important medications on a long-term basis. Strong support from family members, friends, and support groups is important. This support contributes greatly to their overall well-being and resilience, helping them navigate any challenges they might face. Living with a congenital heart defect often means committing to lifelong care. This remains true even if the heart defect was successfully repaired in childhood. As people with CHDs grow older, new health issues can sometimes arise, or previous issues might require further attention or adjustments in care. Adults with CHDs need to see specialized adult congenital cardiologists. These doctors have the specific expertise to understand their unique medical history. This specialized care helps to manage any potential long-term effects, and it plays a crucial role in maintaining good heart health over many years. Transitioning from pediatric to adult care is an important step. There is a great deal of hope for the future regarding CHDs. Medical research in this field continues to advance very rapidly. Newer, more effective treatments and innovative surgical techniques are emerging. Scientists and doctors are constantly learning more about what causes CHDs. This growing knowledge directly leads to better prevention strategies and care. The journey for individuals and families affected by CHDs can be challenging, but dedicated medical teams around the world are truly committed to helping every single heart, no matter how small or complex, thrive. The future holds promise for even better outcomes and quality of life.